Okay, welcome back. And again, thanks for joining me today for a webinar on treating stiff knees. So a symptom specifically in the knees that occurs with different conditions. And I'll talk a little bit more about that. And obviously, it's more about using our what's called our personal therapy system, a photobiomodulation system to help with these kinds of symptoms. My name is Dr. David Kanashko. I'm the medical director at BIOFLEX Laser Therapy, and we specialize in photobiomodulation. You may have heard that as red light therapy or cold laser therapy. There's many different names. All my webinars are recorded and then they're edited, then uploaded to our website at bioflexlaser.com. So if you in the future want to watch other webinars or what have you, you can just go there, top right corner support, and then you'll see personal therapy webinars. Okay. So I'll do a little bit of an introduction about our equipment as usual, just for anyone that's new here, and then talk about some of the conditions that will result in having the symptoms of knee stiffness. Usually you get some pain with that too, but specifically knee stiffness, and then what kind of treatment options that there are out there. And then specifically about what photobiomodulation or red light therapy, whatever name you want to call it, and how that might be helpful. And then a little bit of research. There's actually a fair amount, but I'm just going to touch on a few papers so you can understand that this is pretty well researched, followed by how you're going to use the equipment to treat your knees with our devices, and then always time for a Q&A at the end. Should you have any questions as we go along, just type them into the Q&A box, and I'll get to them at the very end of the webinar. And certainly in the chat box, you're free to chat amongst yourselves. Maybe let me know where you're from, if you're using the equipment, or if you're new to BIOFLEX, any information, how's the weather out there kind of thing, would be great. So very quickly, we have, our company was founded on using professional grade equipment for healthcare professionals for treating a whole bunch of different conditions, musculoskeletal and wound care and all sorts of different things. And then about 6, 7, 8 years ago, we got into the consumer market where we designed the equipment to be a little bit easier to use, and some other subtle differences that make it effective for home use. And we have three main pieces of equipment, the personal system P120, P180, and then a mini port home system as well. They all function pretty similarly with respect to the light hardware, which is what you're seeing here. It's a silicone-based pad with bicolor superluminous diodes, which are a hybrid between an LED and a laser. And these emit both red and near infrared light. First red, then near infrared. The first light that's emitted is red light, and red light's actually a really great wavelength to use for this type of treatment. The only downside of red light is that it doesn't really go that deep into the body. And mainly that's because it's absorbed to a large degree by certain photoacceptors in the skin and just beneath the skin, like melanin produced by melanocytes. So that's what gives you your skin color, and hemoglobin in blood, and myoglobin in muscles. Lots of different things can absorb red light. Therefore, it maybe only goes 5 millimeters to 10 millimeters in total depth, which is great for superficial structures and pain relief and local circulation, that kind of thing. But when you talk about deeper areas, then near infrared is used, and that wavelength is around anywhere from 780 to the 800s, like 840, 850 nanometer. Traditionally in research, it's usually 810 to 840, and that's what tends to be used. And this light can go much deeper because it's less absorbed by photoacceptors that I mentioned previously, and therefore it can kind of percolate and go deeper, especially into joints. And you might say, why not just use near infrared? Well, red light actually is quite beneficial to use first. And number one, it does a great job of superficial treatment, but it also is interacting with photoacceptors. And when you then treat with near infrared light, there's less of these photoacceptors that interfere or be absorbed, which means there's more light or more photons of light that can actually go deeper. So that's in part why we'd use red. Also, red light treats a lot of blood, circulating blood, and that's kind of important because it can actually affect stem cells and white blood cells for anti-inflammatory effects. So really, it's quite important to use both red and near infrared. The controller is straightforward to use. You have different areas of the body that you would pick depending on what you're treating. Obviously, today we're treating the knee, so we're going to be using that specific protocol. You can see there's other buttons at the bottom, like lower left is power. Obviously, there's a stop function that stops the treatment completely. And then there's a start and a pause function. And then there's a stage function that I'll talk a little bit more as we go along. Okay, let's get into the content for today, which is about knee stiffness. And the latest stats I found was that overall prevalence of knee stiffness, and usually you get pain with that, is about 46% of the general population. Obviously, it's more common in middle-aged and elderly folks, and it's definitely more common in females compared to males. That is probably due to the angulation of the femur and the tibia, creates a bit more angulation, so a bit more stress on the inside of the knee. That's because of the angulation of the hips, or the way the hips are designed, obviously for childbirth in females, and so therefore you tend to get more issues in the knees with females. That's just a reference. So knee stiffness obviously is a symptom of some kind of underlying condition or pathology, right? So there's lots of things that can cause knee stiffness. I'm going to focus on one main one today, or a couple, but I'm going to talk a little bit about all of them. One is, and I've talked about this in the past, is meniscal tears. So a meniscus is a sort of a hard gelatinous cartilage that is meant to shock absorb between your femur and your tibia and the knee. So it's really critical for reducing stress to the cartilage, the hyaline cartilage of your knee. Usually tears, if you've torn it. Not always, but usually it's an injury, you hear a pop, doesn't sound good, and then you get stiffness and swelling. And if it's bad enough, you might get locking. Oftentimes you get some swelling, and it's not uncommon that the knee feels like it's going to give out a little bit. So usually you need some imaging to figure out what's going on there. But that's one common cause of stiffness. Stiffness, by the way, when we talk about stiffness, that oftentimes relates to what's called joint gelling. And that's really just increased internal swelling of the joint. So when you have increased swelling of the joint, then it's almost like it's sort of ballooning out in a sense with more fluid. And then that reduces the ability of the joint to move. So that's part of the issue of joint stiffness. Another common cause of joint stiffness and pain are ligament sprains. There's really four main ligaments of the knee. Well, there's a lot more than that, but there's four major ones. The most common ones that are sprained are the MCL, that's a medial collateral ligament, that's on the inside of the knee. And then the anterior cruciate ligament, that's on sort of in the internal aspect of the knee. I'm sure everyone's heard of an ACL tear. These are the more common ones. And typically, again, if you've done this because it's usually due to an injury. The MCL, you can kind of tell that it's quite painful on the inside of the knee. The ACL is a little trickier, but you tend to get a lot of more swelling with that one, and instability of the knee. The two other major ligaments on the outside of the knee is the lateral collateral ligament, or the LCL. That one's not normally damaged very often because it's super strong. It's like a cord-like ligament. So it takes a lot of trauma. I tend to see that more in like car accidents and like really serious. If you're watching, the soccer where they tackle the players and they hit the side of the leg, that can snap the ligament. I'm actually quite surprised that these soccer players are able to play. Although I have to say, and this is a little side topic, I have to say I'm watching the Euros and the Copa, right? So I'm not a huge soccer fan, but these are, it's the peak of the soccer, right? And so it just seems that they fall a lot. Like you can tell on video play, they're not hit, or they're not hit hard, and they're like rolling around in pain and grimacing, and just to get time by time and maybe get a penalty or whatever. But I just have to compare that to hockey, right? So you look at the Stanley Cups. I mean, these guys are playing with broken bones, broken ribs, like all sorts of stuff. They're not complaining. They're out there playing, right? I mean, yeah, they dive a little bit here and there, but I don't know, guys, get your soccer act together so that it's not quite as embarrassing compared to like real sports like hockey. Anyway, I digress. So another common, if you want to comment, by the way, feel free to do that. Another common cause of knee stiffness, and I see this actually quite a lot clinically, is called arthropibrosis or stiff knee syndrome. This is actually, well, maybe 6 to 10%, although I think it's a little bit higher, of people have had surgery to their knee, and they end up worse. Like they end up with a lot of stiffness. That could be due to ongoing swelling, scar tissue adhesions, that kind of thing. You tend to see it in knee joint replacements. That's where I see it a lot. And to be honest, I think it's way higher than 10%, but I'm not an orthopedic surgeon, so it's not like I'm seeing them all the time. But and then like ACL surgeries where they open up the knee and or they do stuff in the knee, and sometimes they get resultant stiffness. So that's fairly common. It's stiffness and pain and swelling and decreased range of motion. And then, of course, arthritis. And that's really what I'm going to focus on for today's webinar with respect to stiffness, because that's the most common cause of knee stiffness. There's osteoarthritis, rheumatoid arthritis, post-traumatic arthritis, where you have an injury to the knee that like torn menisci or other things like ACL tears, they lead to earlier onset of arthritis. And obviously, the symptoms are stiffness and pain and swelling and decreased range of motion. So osteoarthritis, so I'm going to focus on this a little bit more. According to the World Health Organization, it's one of the significant contributors to disability amongst musculoskeletal conditions, quite prevalent, as I mentioned earlier. And then once you get over 55, they say the prevalence is over about 70%. So, it's really common. Onset, again, usually 40s and 50s. Although it can affect younger people, especially like RA, but not commonly. And you'll see a lot in athletes, usually with joint injuries, that kind of thing as well too. And as I mentioned earlier, it's actually a little bit more common in women. Symptoms, as I mentioned, stiffness and pain and trouble moving the joint, that kind of scenario. And as a consequence of this reduced kind of movement, you start to lose strength. And this makes it difficult to do things like squatting and climbing stairs and all these different things. So if you have arthritis of your knees, you really need to focus on strengthening exercises, either like good ones, right? Like water exercises, isometric exercises, things that don't stress your knee a lot. If you're not sure how to do these, I would suggest seeing a healthcare professional to get a little bit of guidance on how to do that. But you really should be concerned about maintaining your strength, because you lose a little bit every year, and then it gets to the point where you have a difficult time getting around. And it's not just a joint, there's muscles and other soft tissues around the area that oftentimes are affected as well. Usually the symptoms come on slowly, but you can just wake up one day and go, holy crap, my knees are stiff and sore, and they felt okay a week ago, and boom, it's there. That's not uncommon, but usually it's a slow graduation of, your knees are feeling a little bit and they get a little bit more stiff, and then you kind of realize that you have a problem. Which, by the way, it's critical that you maintain joint health and that you start treating them and taking care of the knees even before they're symptomatic, because look at your family history, and if there's a family history in your that's present, then you'll want to start preparing for that well before you start to have major problems. So the problem with arthritis is that it's oftentimes, it is progressive, so the changes will slowly happen over age and are chronic. And eventually the joint can become unstable and it can cause long-term issues. So being less physically active when you start to have these kinds of symptoms, then it can lead to other issues like cardiovascular issues and obesity and diabetes and all these other things. So it's really important to maintain one's physical health. So OA, or osteoarthritis, makes it movement painful and difficult. And this will affect all aspects of your health, including mental health. It can affect your trouble sleeping. Sometimes you need to put a pillow between your knees, and all sorts of problems with relationships and everything. So, it's important to do what you can to take care of your body. If you look at just a general kind of knee joint, this is what it looks like. Well, not knee joint, a joint in general. You have two bones, right, connected, and then there's a hyaline cartilage in between, and and you have a synovial membrane and a joint capsule that keeps it all together. So what happens is you have the synovial fluid that circulates around, and actually that's how you get nutrition into the hyaline cartilage in the joint itself. But when you have joint stiffness, you start to have inflammation on the inner lining of that synovial membrane, and that inflammation leads to increased synovial fluid production, and it actually causes the joint to have swelling internally, and then disruption of the ability of that joint to fully, flex and extend, and hence joint stiffness. And you see that a lot more with lack of movement. So you'll see it with first thing waking up in the morning, and then you go to stand up and you go, oh my God, my knees are stiff, or watching a movie or a show or whatever, or sitting down for a long meal or whatever it is, and you get up and you go, oh, or a long car ride. That's arthritis, unfortunately. So that's the deal. And raise your hand now if you felt those symptoms. Yeah, probably a few. So obviously it causes, you get older, you get these kinds of things. You call it joint injury. If you're heavier set, that might increase these issues as well. Sedentary lifestyle, and there's a genetic component as well. So what happens is with osteoarthritis is you start to get destruction of the cartilage. You'll start to get bone kind of remodeling because of this destruction. Then you start to get this weakness in the muscles. So it's a whole thing in and around the joint and the bones and the soft tissues that will affect the area. I know you guys probably can't read radiographs, but visually, it's interesting. So I want to just show you so you can appreciate what's going on inside your knee. So on the left, normal, healthy knee joint. What we're trained to do, is to look at the joint line in the space. We can actually oftentimes will measure them out. You can see on the left, by the way, you're only going to see bone. You're not going to see soft tissue. So I cannot see the meniscus or the cartilage here. So x-rays are of no value to see those soft tissues. Well, limited value. But what you can see here is a spacing. Now on the right, on the inner portion of the knee, you can see here the spacing is decreased. And when it's decreased, that is a sign of arthritic changes, because the hyaline cartilage, the meniscus is worn, so it's closer together. As you can imagine, when joints get closer together, they're less able to move freely and feel more stiff as well. So it's kind of what it looks like in and around that area. There's other signs. You can see this is kind of a bony formation here, and it's called sclerosing, which when you have excessive stress to bone, it tries to repair itself by making more bone. So that's the sign. Those are the signs that we look clinically in radiographs. And you can see arthritis is graded via x-rays from 0, which is healthy, all the way to 4, where it's like almost bone on bone arthritis. And you can see during the graduation, you can not school graduation, but graduation of the progression of the arthritis, the bones get closer and closer and closer together. By the time you have about 40% joint damage is when you start to see symptoms, really experiencing them. So you can be well on your way to have problems, even though you may not be aware of them. So here's just more of a graphic illustration of what's going on during arthritis, osteoarthritis, and wear and tear of the joints. So stage 0, 1, 2, and 3, and 4. Most of the time, you're going to start to feel some stuff around stage 2. It's doubtful you're going to feel a lot in stage 1, but 2 and 3 is where you start to really notice things. By 4, you're kind of you're unfortunately you're pretty bad. So oftentimes your doctors will say, oh, you better start thinking about a joint replacement kind of scenario, and no one wants to have that. They're getting certainly a lot better at knee joint replacements. Hips are really good. Knees are not bad, but it's a lot more complex of a joint and lots more stuff going on. And it can lead to, as I mentioned, side effects and complications like that joint stiffness I talked about. And so you need to take care of your knees before it gets to that state. So a little bit of nerdy stuff here is what happens inside the knee joint during arthritis is you have this sort of progression of a positive feedback loop where you have synovial inflammation. So that's can imagine the joints encapsulated and sealed, and then on the inside of this capsule is where you have the synovial cells, and these cells will start producing all sorts of things, including synovial fluid, but other kinds of enzymes called MMPs, which matrix proteinases, and they degrade cartilage. And then you get all sorts of other things going on inside the knee joint that will contribute to joint stiffness and cartilage breakdown and so forth. Treatment option wise, there's at-home treatments. I'm going to talk a little bit about that, but that's really important. That's the most important thing. Certainly, you can see a healthcare professional for treatment as well. There's drugs, but I don't know. I personally, like NSAIDs show an increase in chronic pain when you're taking NSAIDs, like Aleve. Yeah, sure, it may provide some temporary relief, but long term, it's going to actually be more harmful. Do what you want, but if you can put up with it and do other things, you're better off in the long term. And of course, last option is surgery. So self-care is really important for managing knee stiffness. And obviously everyone's different, so every approach is going to be unique to what's going on with you, and which is why you need to see a healthcare professional to kind of sort this out. Using our equipment is part of the process as well. You need to stay active, maintain a good weight, all these things I'm sure you're aware of. The exercise goals really include maintaining or improving aerobic fitness, range of motion, and strength, and reducing the risk of falls in the future. So it's interesting that studies have showing the benefit of aerobic exercise like treadmill or a walking, that kind of thing, and strengthening, and something called neuromuscular exercise, aquatic activities, and balance exercise. There's a program called GLAD Canada. I encourage you to look that up, gladcanada.ca, and they give you lots of great exercises that have been known research-wise, have been shown to be helpful for knee stiffness and arthritis. So that's definitely a great resource. Whether you're in Canada or not, doesn't matter. You can check that out. Neuromuscular exercises are really important. That's kind of like Tai Chi is like a neuromuscular exercise. It focuses on reducing weakness and improving sensory motor control and functional stability by means of progressive performance exercises. You'll see this in, like I was watching soccer. You'll see this when these guys and women warm up for soccer. They're doing really specific exercises while they're moving and mimicking what's going to happen in the game. That's neuromuscular exercise, but Tai Chi is a similar one, although it's not, you're not prepping for a soccer match, but you are doing movement therapy, and it's really good. Pilates, those kinds of things, even yoga, those are really great exercises. Aquatic exercises are really good as well, but, downside is not everyone has access to a pool, right? And again, balance exercises, these are really important. And this will eventually help to reduce your risk of falling. In fact, there's been some research that showed that Tai Chi, along with physical therapy, Tai Chi led to similar improvements with physical therapy with osteoarthritis at 12 weeks, and greater improvements in depression and physical component of quality of life. That may be in part because it's a social thing. So, those are the kinds of things you need to look at when you're trying to take care of your health for these kinds of issues. So normally exercise therapy is you have it initiated first, sort of personalized for you and what's going on with you, and then your preferences. And you talk about your expectations and your pain and sensitivity, all these kinds of things. Oftentimes people are really afraid of doing things and they think it's going to make things worse. And usually it's not. It's going to help. It's just get over that fear. And it's usually a multimodal kind of treatment. So, that's important as well. 1 hour per week of moderate to vigorous exercise. This was associated with a greater likelihood of remaining free of disability than activity lasting less than 1 hour per week. So, at least 15, 20 minutes a day would be optimal. And people with OA, obviously, the heavier you are, the more issues that there might be as well. So really, the options for treatment are called SMART, the acronym. So S is start low and go slow. M is modify activity when you need to. So, if something is hurting more than a day after your activity, you need to modify it. Activity should be joint friendly, obviously. And you need to recognize safe places that you can do these things in a safe way, maybe people around or, guidance, that kind of thing. And then T is for talk. So obviously talk to a healthcare professional or someone that's certified to really be able to assist you. So why photobiomodulation? That's what the talk is about, right? Is light therapy can do lots of things, including reducing inflammation, reducing edema, helping repair some of the cartilage, those kinds of things. It will work directly on the joint, and it will work indirectly through the blood. So helping with stem cells and blood flow, those kinds of things. And the key reasons really for using this for joint stiffness in the knee is that it's going to decrease the swelling inside the joint. It's going to improve circulation. Obviously, there's no side effects, no risk of side effects with this type of thing. It may even improve the cartilage growth inside your knee. It's easy to apply. It's non-invasive. And hopefully it decreases your dependence on Aleve and some of these other drugs that notoriously difficult for your liver to metabolize, for your stomach to deal with, and for increased chronic issues when you're taking these meds. This is a great paper. So I don't know how that passed ethics board, but they looked at the radiological and biochemical effects of laser therapy on chronic osteoarthritis. So they were measuring these nasty inflammatory secretions in the knee, and they were also looking at the cartilage and the joint space to see if laser therapy was helpful. They looked at 34 subjects. They treated them 3 days a week for 4 weeks. They used something called a visual analog scale. That's when the doctor says, hey, what's your pain from 0 to 10? 10 is really bad. That's what a VAS is. And they looked and measured the joint space. I showed you that earlier. That's kind of why I did that. And they did it before and after 4 weeks, and then 8 weeks following the treatment. And then after the 4 and 8 week treatment, the active laser group showed more significant decrease in all the parameters than the placebo laser. So the results showed that that low-level laser therapy was more efficient in reducing pain and improving cartilage thickness through biochemical changes. By the way, if you have any questions, if you can just type them into the chat or the Q&A box, not the chat box. I do see a couple there. And I'll get to those at the end, although I do see one that's relevant right now. By the way, this is also helpful for arthritis and degradation under your kneecap or your patella. Sometimes that's referred to as chondromalacia patella. And so, again, although not necessarily stiffness of the knee joint per se, but it will help with the symptoms of chondromalacia patella and that patellofemoral issue. Another paper is there a role for photobiomodulation in treating damaged articular cartilage due to injury or degradation? And so it's kind of like a review paper. And what they found was that photobiomodulation can increase stem cell multiplication and differentiation. So stem cells help repair damaged cells. They're like little baby cells that can turn into other types of cells. That's what a stem cell is. And it can help improve the overall joint health. So they concluded that photobiomodulation has positive effects of biostimulation on cartilage tissue and may have a role in treating damaged articular cartilage due to injury or degeneration without any side effects or complications. Again, folks, just type in your questions in the Q&A box. Hopefully, by the way, let me check this. Yeah, you should be able to do that. Maybe it's not active, but I think it's active. Just type them into the Q&A box. I'd really appreciate that. Okay, so using this system, you want to focus on using the knee protocol. So obviously that's what you're going to do. You want to treat all the way around the knee joint. This is really important because you have swelling on the synovial capsule that causes the joint stiffness on the inside, the outside, the front, and the back of the knee. So you'll want to treat that whole area. When you treat the knee, you want to position it in a what's called an open pack position, or about a 25-degree flexion. So you can see this arrow going from the extended knee and open it up to about 25 to 40 degrees. That's the position I'd like you to put the knee in. So shove some pillows under the knee to open it up, to treat and open that knee to allow light get into the joint. So this is kind of what it would look like. You can see there's the knee joint. You need to know where your joint line is. If you're not familiar with anatomy, and maybe some of you aren't, then you need to feel or palpate your knee, and you'll feel kind of bumps. And take a look online. They'll guide you as to where the joint line of your knee is. And the inside of the knee is the most common spot. And that's what you're going to place the first position over that area. So the midline of the joint line, here's the midline, right? Then you place the pad so that half of it is above, half of it is below the medial joint line, okay? That's the first position. You'll also get part of the patella out in the front and a little bit behind as well. The next is the outside or the lateral portion of the knee joint. Again, you'll need to find where that is. You can feel the head of the fibula, and then just above that is the midline. And then you're going to place the pad on the midline of the outside of your knee joint. So now you've done 2 positions. Each one takes about 14 minutes. And then you're going to do behind the knee joint. Now, for this one, you can extend your knee. That's okay because it's more for circulation. Or you can just shove the pad underneath. It's called the popliteal fossa. This helps to control edema, can reduce what's called a Baker's cyst, and improve overall knee circulation. Okay, so the treatment stages are really important here. I always get lots of questions about when to use the stages and that kind of thing. And the treatment stages represent different dosages and pulsing of the light. There's 4 stages or 4 levels. The first stage is the lowest level of dosage and pulse rate, and then the 4th one is the highest dosage and the highest pulse rate. So if you look at the sort of the knee protocol, there's stage 1, 2, 3, and 4. The red is about 6 minutes. The infrared is about 8 minutes. Can't see the infrared, you can only see the red, okay? So that first stage, the light coming out for red is continuous wave, a steady stream of light, and the near infrared is pulsed at 50 cycles per second. You can't actually see that, and about 70% duty cycle, which means about 70% of the total power that the pad can produce. And then when you move to stage 2, the red light's pulsing at a much higher pulse rate, and the power is slightly less only because we need to do that to be able to pulse the light. And the near infrared, we can see here we've jumped to 90% duty cycle, so quite high. And then the third stage is the pulse rate has gone down a little bit in the red. By the way, these are based on 30 years of us using the equipment on patients. And so we found that these are the levels or stages or the pulse rate or parameters that seem to work best. And then lastly, the red is pulsed at extremely high rate at 5,000 at 90% duty cycle or 90% power. And the red light or the near infrared light is now continuous wave. That's a maximum power that can produce. And don't necessarily think the maximum is the best, okay? That's not how photobiomodulation works, okay? You know, you go to the massage therapist and you go, just push in as hard as you can, right? No, like, first of all, let them do their job. And the other thing is when you're using light therapy, sometimes the lowest levels work the best. And if you just skip to the highest levels or do it too quickly, you may not get the optimal results. So start with level 1, do several sessions. I say anywhere from 4 to 8 sessions before you decide what to do next. So if your symptoms are improving, then just keep it at that level. That's working well for you. If, however, your symptoms are not improving or they were improving and then kind of plateauing, then you can move to the next stage. And again, similarly, you want to, do another 4 to 8 sessions. Okay. So sometimes also that you can, if you're finding you're getting great results and then just maybe things tail off and you've tried different things, give it a rest. Sometimes the body accommodates to the treatment, so a week or two of rest and then go back at it, maybe with level 1 again. That sometimes is very helpful. The system is designed to make direct contact with the skin. So make sure you make contact with the skin. Make sure that you use a strap to keep it in position. Don't block the pads with a pillow. You need to kind of keep it open to allow the light or the heat to escape. And don't put it over any bandages or, any creams or lotions, that kind of thing as well. You can contact with your hand or use the strap. And remember that the light pad emits both red and near infrared light. So yeah, it has to cycle through all of that, and then it will pause, and then you move it to the next spot. So don't move it until it's paused. So remember, knee stiffness is a sort of slow progression kind of a symptom, and it needs to be treated basically regularly, right? It's not an injury that will just go away, unless it is an injury, right? Like a meniscus tear or something. But most people will start to respond between 3 and 6 sessions, but it varies, right? So you need to be a little bit patient. So initially start treating once a day, maybe a week or two at once a day. Then you can go down to maybe 3 to 5 times a week after that. And once you're really feeling a lot better, then maybe down to once a week or twice a week. But if you have OA, treat every week. Keep treating it. There's no harm in doing that because it helps to slow the progression down. This type of light therapy doesn't interfere with medication, so I wouldn't be overly concerned about that. And of course, we recommend consulting with a medical professional before you, do anything to your medication, obviously. And maybe talk to your doctor about how great this BioFlex light therapy is working for the knees, and maybe you should stop prescribing medication if this is working, kind of scenario. So anyway, the ultimate goal of using light therapy is to slow the progression of the stiffness and the symptoms of the knee, right? And to give you a better quality of life along with the other types of treatments as well. So the big picture is treat around the entire knee joint. Make sure it's in the open pack position when treating the inner and outer portion of the knee. Do your exercises religiously, do other types of therapy. There's lots of other things I didn't get into today. So that's important as well. So next 2 webinars, I have one for more for healthcare professionals, but anyone can tune in. That's using laser therapy for multiple sclerosis symptoms. And then one for using the personal system for post-workout muscle recovery, whether that's a walk or a run or a jog or a pickleball, whatever. I'll talk about how to use the equipment for that as well. If you need to reach out to me, you can do so. Email david@bioflexlaser.com. I do see a few questions here. Is there any research on the best protocol frequency for patellofemoral issues past the acute phase? Amber, so I'm not really quite sure if you're a healthcare professional or not. I believe I've done a webinar on chondromalacia patella, where I talk a little bit about how to approach that, but there's not research published just on chondromalacia patella. It's going to be similar to how you treat the knee itself anyhow for arthritis, so they're pretty much similar to that. And I think I covered that it does help Baker's cysts, so I did mention that. So Mary, so you have knee replacement on September 17th. After my surgery, can I use the BioFlex for swelling and healing? A couple things, really important. Stop using the device at least a couple weeks before your surgery, because it increases blood flow, and you want that just to go back to normal for surgery. And then you can use the BioFlex literally the day after your surgery. So if you need any more advice on that, just send me an email. Do you recommend daily treatments if one has a home unit? So I think I talked a little bit about the frequency of treatment. Daily when things are pretty rough, and then as things are pretty or better or improving, that kind of thing, you can reduce frequency. And as a maintenance, even if you're feeling pretty good, at least twice a week, maybe 3 times a week. So with respect to surgery, I'm not promising you're going to avoid surgery with this. I am just saying with all the other things I mentioned, exercises and all the rest of it, and photobiomodulation, then there's no reason if you start early enough, then that you could avoid surgery. But there's so many factors at play, genetics and everything else, and it really depends on how significant your OA is already, Allison. So I think it's very helpful. I mean, I've been doing this for a long time. I've seen some amazing results, even on bone arthritis, but you're not going to see repair of bone on bone arthritis because there's no cartilage to repair anymore, unfortunately. A question about using the P180 for dogs. I actually did a webinar for pets. So Kent, if you want to go to bioflexlaser.com, go to support at the top right and go to BioFlex Personal Webinars. You'll see the one I did for pets. And I talk a bit about that. Hopefully your Great Dane recovers well. You can use it on wound and eczema. And I did do a webinar on that as well. For gout, yes. In fact, because it's an inflammatory issue, it can be helpful for gout. We actually have a gout protocol in our professional equipment, but you can modify off-label use for the personal system for gout as well. Awesome. Okay, so let me just see. I see there's stuff in the chat box. Okay, looks good. I have severe arthritis in my knee, healthy, not overweight. Is it possible for me to improve with treatment to level 3? I'm not sure, Helen. I understand that question. In my knee, level 4. Oh, so you have grade 4. Sorry, you have grade 4 arthritis. Okay. So you basically have bone on bone. So what this should do is reduce swelling, reduce inflammation. What it's not going to do is do anything with the joint cartilage. That's gone. It's just gone. But it can really help. I've seen incredible results with bone on bone, but I've also seen where it hasn't done a lot because it's so severe. So it should be helpful, but yeah, you're at when you get to end stage, that's really tricky, unfortunately. Thanks everyone for joining me today, and it is helpful for fractures. Um, I prefer the professional equipment because you have a laser that can go deeper into the bone, but if you don't have that, you can still use this for helping with fractures. The main difference between the professional equipment is that there's a class 3B laser that's sold with it, along with how the equipment's made, because it's designed to be used by healthcare professionals in a robust clinical setting. Normally in the real world, well, normally people shouldn't be able to buy class 3B lasers. It's restricted, but then there's the internet, so you can buy whatever you want to. They're dangerous unless you have proper training. So my opinion is that anyone should be able to use it, but anyway, that's what the regulations are. So hopefully the FDA is not listening in. Take care, everyone. Have a great afternoon. See you next time around.